Hello, everyone. Cyd Notter here, and I have such a special guest for you today. My guest today is a lady that I met, several months ago through an online chat forum, and on Chef AJ really is how we got to know each other. And I really admire her work, and she's just the coolest person ever. And so I want to introduce you to her because she's an expert in the field of helping senior citizens with their exercise routines and lessening their pain and all sorts of things. And today her topic is going to be tips to reduce inflammation during exercise. What a special topic. You know how much we've talked about inflammation on my previous shows and webinars. And Angela has got the information that you're going to need to help with that as well as far as exercise goes. So let me tell you a little bit about Angela. Not only is she a physical fitness and yoga instructor, she's also a massage therapist who specializes in wellness for older adults. And even though she's been teaching senior citizens since her 30s, at a time when she embarked on her own healing journey, and maybe she'll tell us a little bit about that. But now it's 3 decades later, and she's a senior citizen herself, and she combines all of those years with a unique combination of empathy and encouragement for older adults that are seeking a healthier lifestyle and just to feel better and reduce their pain and reduce their inflammation. So Angela also researches the latest finds in personal fitness, and she consults with each client's medical practitioners in order to tailor-made her advice specifically for her clients, which is really cool. It's not like a one size fits all. She really wants to help you individually to fit your needs. So she's based in Miami Beach, Florida, and she serves South Florida clients, and she's Brooklyn born with a background in Shakespearean theater and a lifelong passion for song, which I love that. Plus she's an Italian gal, you know, that just touches my heart. Angela Fischetti. I just love that she's a Brooklyn Italian girl. So she had me at hello with that right there. So without any further ado, well, let me go on to say that she's going to demonstrate some exercise routines for us today. And if you have any questions during the routine, be sure to write them down because we are pre-recording this session so it can be broadcast in several different places later. But any questions, if you're watching on YouTube, feel free to type those in the chat box below the video, and one of us will see those. I'm sure we'll be monitoring that. Or you can contact Angela directly at her website, and we'll share that website information at the end. But the name of her business is Boomer Wellness and Beyond, right, Angela? .com.
Boomerandbeyondwellness.com.
Sorry, Boomer and Beyond. Boomer. Well, okay, I just messed that up, but boomerandbeyondwellness.com.
You got it.
We'll share that at the end as well. So welcome, Angela.
Well, thank you for having me, Cyd. I'm very excited to be here. I always get a little bit nervous before, but I'm really, really super excited to hopefully pass on some information that's helpful and useful to your viewers.
I know you will. I've seen you in action before, and everything you present is awesome.
Thank you for that. I appreciate it.
So let's talk about you, a little bit about your background, your business, any health improvements that you've seen from, I know you follow a whole food plant-based diet as well, right, Angela?
Absolutely. I mean, really whole food plant exclusive, no packaged stuff, you know, nothing like that. I have been, I guess I had a journey with this whole process that began back in 86 or 87 after I read Diet for a New America. And that was it for me as far as eating any animal products, except it was vegetarian. I went vegetarian. And it literally, I came out of my room, Cyd looked down, saw my cat, and her name was Honey Bunny at the time. And I just looked at her and I said, well, certainly, all I could think of at the time was animal flesh, right? I didn't make that connection. And we're Italian, right? So, you know, I didn't think about cheese being a problem, but of course it was. And I would say probably within about 3 years later, about 1990, 91, I went vegan. But because of certain health issues over the decades, It was something where I would often be vegan for a while, in a couple of cases, twice I was for 5 years each, even raw vegan. And but it was the pull of the pleasure track foods that would bring me back in. And for me, it was cheese and dairy. And it would pull me back to vegetarian. And really that went on and off for decades. I had several different pathologies and diagnoses, one of which was manic depression back like in 1991. And the big help there was I actually went to an addiction center in Arizona that was founded by yoga Sikhs. They were medical doctors and RNs, but they were yoga Sikhs. So that's how long ago I learned about how important yoga can be as therapy, because they presented it as yoga therapy. We had to do a couple of Kundalini yoga classes a day, and that was in the heat of the sun, in a barn, unair conditioned in Arizona. Spectacular for anybody who comes from like an addict background, because I went after the endocrine system. And I also learned about vegan food there. And also we never were treated with medications. We were treated with herbal supplements, and that were, you know, individualized protocols. And so my life was altered by this. And that's where I was also introduced to the concept of massage therapy. That all those years ago has informed my work now in those fields of fitness and wellness. And but it was still not linear. And anytime, Cyd, there was like some sort of crisis in my life, some drama, I'd go back to the vegetarian, I'd go back to that dairy. But, you know, it was like real close by, and you want to have a clean environment. And it was until I got to the point where the diagnoses really became very scary, meaning I guess it was back when I was about 59 or 60, I'm going to be 65, that I had all these diagnoses within 3 months. I got diagnosed with the osteoporosis of a 90-year-old. I got diagnosed with subclinical hypothyroid. I had really bad vegan blood work. I mean, really bad, like low D3, low B12, low calcium, low protein. I had really high, super high homocysteine. I was told I was a heart attack waiting to happen. Not heart disease, because I exercised a lot, but heart attack waiting to happen. And when, you know, you have that why that makes you cry, that was it. That's what put me over the top. And I found Chef AJ's approach to really be helpful to me in so many ways, because she calls it SOFAs free, which is salt, oil, flour, alcohol, and sugar free. That was perfect for me, because I was also, from that manic depression diagnosis, on psychotropic drugs for 25 to 28 years straight. It blew apart my sleeping neck. It just blew it apart. For many decades, I slept 1 to 3 hours a night, and that is not an exaggeration. So now I can get, I know it doesn't sound like much, but for me to get 5 hours is a thrill. And I did something, Cyd, I will not ever suggest anybody do, but I weaned myself off of all those medications, and I've been off of them, and I've been drug-free for about 5 years, but I do have medical issues because of those drugs. Mm-hmm. And I was told by my endocrinologist that the lithium that I was on about, I don't know, 28, 30 years ago now, for 2 years, I was on it for 2 years back then, is the cause of 3 masses in my throat, 2 thyroid nodules, and 1 enlarged lymph node. Mm-hmm. And yeah, and so I asked her flat out, I said, well, because most of the masses in my body that I got diagnosed with, 8 of them at one time, I asked her, they're mostly endocrine related. could they have been affected by these many different psychotropic drugs that I kept getting cycled off and on, you know? And she didn't say no, Cyd. She just went like this. And that's when I thought, I'm going off. And I did what you're not supposed to do, but I took, I guess it was about 2 years to slowly wean myself off. And like I said, I'm not on those drugs now after all these years. I did shed my body of a small orange sized cyst off the right ovary. I did get rid of endometrial hyperplasia. I am no longer diagnosed as subclinical hypothyroid. I watched my doctor. I made her write it, by the way. I said, I want to see you write that I have no hypo nothing. And she wrote no hypothyroid. And I was like, thank you. And then also I will say downgraded, because you know the medical community doesn't like to say reversed. So a downgraded osteoporosis to what I call age-appropriate osteopenia, because let's be clear about something. Osteoporosis is most definitely a pathology founded in inflammation, as I've learned from you, as is hypothyroid founded in inflammation. But osteopenia is not a pathology. It is a normal process, folks. Despite what some folks try to keep telling us, especially as women, that we should be doing the meds and all that for osteoporosis when it's osteopenia. I'm not saying to scoff at it. I'm not saying to just dismiss it, because I don't do that. It drives my life, meaning this is why I maintain strength training at 65. This is why I eat lots of dark green leaves, even with my fruit, except melon. I'm always with the greens. Now, I'm not suggesting that everybody go out and really pummel greens, because maybe you're medicated with blood thinners, and you would have to talk to your medical healthcare practitioner regarding that first before just, you know, taking in a lot of greens. But bones love minerals. So part of this is kind of part of my anecdotal approach to what I've done for these different conditions. I live with the 7 masses. They're all benign. Every single specialist is like, I don't know what you're doing, but keep doing it, because I kind of created a protocol for myself. Do we know which part of the protocol is most important? No, there's no way to tell. There's no way to test that. And so they're there. I just look at them going, okay, you're just taking up permanent, and you're not permanent, but temporary space. And I understand. And I'll, you know, let's live, you know, kindly with each other. That's how I just simply look at it. I look at Chris Carr, who's been dealing with stage 4 rare cancer for 20 years and has a vibrant life. Why not me? If she can do that, I can do it. That's how I look at all of this. So there's been a lot of great stuff that has happened, but I am somebody who embraces not just the food, but the lifestyle. Right. No processed food over here. You'll not find any of that stuff in the environment.
Yeah, I like what you said there about the osteopenia, because as we age, that's right. Our bodies don't need all that stuff when we're in our childbearing years.
Thank you.
It's a natural thing to have some
loss of, you know, estrogen. I kind of look at it. Look, this is me, and this is some of my readings, and I'm not saying this, you know, I'm just saying that I look at it and I go, it's very possible Mother Nature is helping us, protect us from breast cancer post-menopause. You know, that's how I just see it, you know. Whether that be truth or not, I'm not sure, but based on some of what I've read, that's kind of what helps me, you know. And so no excuses, right? No excuses. I played the little victim for a little while there, and I was like, well, that's boring. And that's what I love about our community. The whole plant exclusive plant-based community, the whole tribe, everybody's trying. And everybody's looking for the positive side of this. And you've got to look for the positive side, folks. And let me just say something to everybody, and I mean this from the bottom of my heart. You must do your research and to be a self-advocate for your health. And come in with the information for the doctors, because you know what? You help them as well. You do. You do. I mean, I had a couple of doctors who wanted to just cut me up, remove body parts. And I was like, I fired them. And now I have doctors some who are in the medical plant-based community, and those who are not, who are definitely respectful of me. I mean, I have some of them who they come up to me and I'm like, I do yoga. And I lift weights, and I'm like, well, great. That's why I hired you, because you look good and you look healthy to me. And that's what I want. And I want people coming at me from the perspective of, well, we just got to remove it. And that's the other word I don't like, when the medical community goes, you aren't crawling on the floor in pain, writhing. Don't talk to me, we. I don't like the patriarchal part of that, whether it's a female or a male doctor. I don't like that. But I do like when they turn around and say, look, I looked it up. I looked at the studies. You know what? Nobody's giving you a hysterectomy, because the cysts that I have, even if they burst, they won't poison me. And I was like, all right, bring on the bursting. Every time I jump on the rebounder, I'm like, let's go, But the fact that right cyst dislodged without any issue. I don't even know when it happened. No idea. There was no pain or anything. So, that's what drives me. It's like, let's put out the positive message to people. But this lifestyle works, folks. This lifestyle works.
Yeah, that's for sure. And you're a prime example of that. Plus, you took control of your health, right? We are our #1 health practitioner, not the doctors.
Thank you.
Remember that. Yeah.
Thank you. Absolutely. I agree with that. Absolutely. And that's why anybody now that I typically more recently engage is from our tribe, because they have an understanding of the food and of the lifestyle pillars. They understand it's not just the food, there's other pillars involved.
Yeah. Yeah, it's a holistic approach.
Absolutely. Absolutely.
So today you're going to demonstrate some exercises for us too, right? Help reduce inflammation.
Absolutely. And the thing with my perspective is coming at it from the point of view of, hey, it's how you do the exercise also that's going to contribute or not to inflammation. So basically, I'm going to relay 4 tips on what we can do to keep inflammation down while we're strength training. This is more specific to strength training. I did want to let the audience know that I'll be following the guidelines of our plant-based doctors. They typically refer to the American College of Sports Medicine for the exercise guidelines. And those guidelines consist of, when it comes to strength training, to do it 1 to 3 sets of each exercise. A set is a group of the repetitions, and the repetitions that the American College of Sports Medicine discusses is 10 to 12 repetitions. I'm going to tell you from my personal experience, I'm at this for 35 years, is 8, I'm going to just do a little shift of 8 to 15 repetitions per exercise. They discuss doing it 2 to 3 times, twice a week for 20 to 30 minutes each session. Now, there are people out there who are very seasoned, right, at their strength training. So to them, I'm going to say, then do it longer and more often. And this type of approach really has a wonderful effect on pathology, slowing it down, downgrading it, and preventing others. And for those of you who are brand new to exercise or brand new to strength training, well, you go with that 1 set. You go with the twice a week. That's okay. It's all good. You've got to start somewhere. But today's program, I'm going to be bringing in some exercise accessories, and the I only recently, by the way, Cyd, had a cast on my arm because I had a fractured scaphoid bone. Very concerned that I would get osteoporosis because you can't lift weights in this hand, right? So I had three hand surgeons. I got the opinions from all of them, but the one I'll call like the head hand surgeon, she was the instructor of the other two. She's 75 years old, considered the #1 hand surgeon in Miami and Miami Beach. She also is the hand surgeon for our teams here for the NBA and the NFL. And I was like, well, that's good enough for me. All right. And I told her, I don't want to get osteoporosis. I have some ideas. So the cast at the time was all the way up to here, right there. So if you go to flex the arm, I catch the cast. What happens to the bicep? I can't recruit it. And so, or minimally. So I told her my issues, and she said, well, I have an idea, because I showed her the exercises I was thinking about. And she said, first off, you want to mobilize the thumb, and then we got to make that cast lower. I went to my team that I had hired, and I said, I need to put my bands and my tubing in this space so I could do my work without jeopardizing the hand. Plus, I had to follow the setting within the cast itself. So like this movement of pronation and supination, I couldn't do in the cast, right? So fine, you work around that. But my point is that at one point, they wanted to give, they told me you won't need an operation. They came back after the first CAT scan and said, hold the phone. The bone doesn't look like it's closing. And therefore, if you don't have the operation, you're going to need that cast for 6 months. And I said to them, I'll go for the 6 months. But inside, Cyd, I know me. I knew I was like, I'm taking on this challenge. So that's when I started like eating the greens with everything. The next CAT scan I came back, he said, cast is coming off. That bone is closed. And I'm not kidding you. He goes to me, you're a little bit of a freak. And that cast was off in 3 months and 20 days. It was off. And I was so grateful. And I'm still in physical therapy. The weights I'm using today are kind of light. I'm still in physical therapy for it. But the point is, osteoporosis never came back. The last scan said osteopenia, and I'm like, we did it. It was not pleasant because you have to work unilaterally. So you're working out all day long. It takes forever. But goal was met. So that's what I was excited about sharing with you.
Very cool.
Thanks. Appreciate that. So do you have any questions for me, or should I give my tips first? Because I'm excited to share the 4 tips as well. Should we do that first?
What would you like? Questions or share the 4 tips?
I think we're going to share the 4 tips because maybe that'll help people with the questions as well. So the first tip is going to be alignment. You know, it's how you execute the exercise, the technique and form, and that actually drives my work. You'll hear me talk a lot about the details. So alignment can either increase or decrease inflammation, and we certainly want to reduce it. Again, the exercises you're going to see today will be based on the American College of Sports Medicine. However, we're going to focus on activities of daily living and some compound movements. And a compound movement just simply is like multiple joints, and typically that goes with multiple muscles and also the larger muscles. The second tip is to stay hydrated while you're training. Cyd, I noticed a lot of people, they drink whatever fluid they're drinking when they do their cardio, but I don't see them doing it as much when they're strength training. This is super important to keep that tissue, you know, to keep it, what's the word that I'm looking for? Kind of moist and supple, right? Keep it supple. And so, I don't know from like flavored waters, because sometimes people ask me, but don't ask me questions about hibiscus tea. I don't know this stuff, but I do know about water. And Harvard Health always talks about water, and then basically they're saying it promotes the movement of anti-inflammatory chemicals throughout the body. This is a good thing. Another tip is to switch up intensities. I am going to add to that to switch up exercise modalities, because oftentimes people will keep doing the same thing over and over. They repeat it, but the body quickly adjusts or adapts. The body, so you want to take that into consideration, and you can develop things like, like a stress type of syndrome, a repetitive stress syndrome. You can avoid that by varying up your exercise routine. And finally, something that I really want to encourage people to do is stop and rest whenever you need to. Especially if you have pre-existing medical issues. This is very important, to stop and rest when you need to. Now, I'm not telling you to quit. So it goes along with the concept of just don't overdo it. There is, what I like to tell people, Cyd, is to work at an acceptable level of muscular discomfort for them. Whatever that might be. I don't know what that is. I don't know them personally. Right? And so let's say I'm working on the biceps. So you can see where the belly of the muscle is, right? And typically I'll ask these kind of questions. Well, how's it feeling? Well, it's all right. So because after you do it for a while, you start to feel it. And then it's kind of like, well, does it prevent you or hurting you? The question would be, is it hurting you? Is it painful? Well, no. Can you tolerate it? Yes. And that's the answer you're looking for. However, if you keep going and then all of a sudden you've got pain in the joint, that's unacceptable. You stop the work, give yourself a little breather. So for those of you who are medicated for anything at all, I'm going to suggest that you preview the video first, see if there's something here that you can do. Otherwise, if you're a little unsure, then you show the video to your medical healthcare practitioner who knows your body best, for you to make an informed decision. The other thing to know is that there's delayed onset of muscle soreness for 24 to 72 hours post-exercise. This is normal. This is perfectly okay. I'm at hour 48, and I'm feeling my lower body, I'm feeling the legs, I'm feeling the glute. Now, does it prevent me from doing my activities of daily living? No, it doesn't. Am I in pain? No. Can I work out again? Yeah, to be honest, I can. So those are the answers you're looking for. But at hour 73, and you're dragging, and you're kind of in pain, and that soreness is really intense, well, maybe you've gone beyond your edge. And folks, that's when the inflammatory process kicks in. That's when the body will send out the white blood cells, thinking that it needs to repair and restore muscle tears. Because you see, when you strength train, you do go through a process of like micro muscle tears, but these are normal in the process of breaking down and then building the muscle back up. We just want everybody to be able to perform exercise on a regular basis. So that's my spiel about inflammation and exercise. I'm open to your questions if you have them, Cyd.
Okay. Well, let's see. We understand there's a lot of benefits to exercise, but does exercise have any effect on our production of nitric oxide? Would that be true or false? Nitric oxide keeps our vessels open and the blood flowing. Does exercise have any effect on that?
It absolutely does. It does. So if the question was that if it didn't have any effect, I would say false. But if the question is, does it have an effect? It sure does. And I'll tell you what Harvard Health says about this. Studies show that doing exercise on a regular basis helps arteries by boosting the endothelial cells' nitric oxide production. Pretty good.
That reminds me of Dr. Esselstyn so much. Whenever I hear about the endothelial lining and the benefits of it and how we need
to on that. Absolutely, I agree. Did you have another question?
Yeah, well, you mentioned about post-workout a little bit. So would this be true or false? The post-inflammatory benefits of exercise occur for 1 to 2 hours only. Would that be true or false?
Yeah, it's false. It's a little bit of a trick question. It's false. You know why? Those anti-inflammatory benefits are felt 3 to 12 hours post-exercise. How cool is that?
Wow.
I know, and this is what Harvard Health says, that during workout, the body produces natural stress hormones, epinephrine, which is adrenaline, and norepinephrine. They play a major role in controlling the activities of the immune cells during exercise. They temporarily suppress immune cellular activity, causing inflammation to plummet. There you go. So this is good stuff. So I'm hoping now we're going to do some exercise to help that inflammation plummet.
Let's plummet it, and let's remind the audience that if you have questions for Angela about any of this, right? If you're watching on YouTube, be sure to type that below the video, and we'll be monitoring that, or you can contact her directly and we'll share that website later.
Awesome, perfect. So what I'm going to do now is just kind of set up some more lighting here for you, because I have to step further back and then I have to adjust my camera.
I'm going to take a big drink since you were talking about hydration.
That sounds good to me. I'm just going to move the camera so I'm going to see where I'm landing with it. Yeah, we go. And chindan, as we would say, right? Our families. All right, so we're going to start off first with warming up the body. What I like to do is warm up the spine. So the spine, we're going to be doing spinal extension, flexion, lateral flexion, and spinal rotation of the vertebral column. When I set this up, I'm going to be showing you different angles, by the way, today, but this is the foundation for a lot of the standing work here. I'm going to place the hands to the inside of the pelvic bone. So the high bone up top here is called the iliac crest. With the hands pointing straight down, not turned in, I'm lining up the inside of the pelvic bone with the knees, with the ankles. Now I'm going to turn to the side. I want to just give a little information for those of you who have spine issues, some medical disclaimer. The spine issues I'm talking about are osteoporosis, hyperkyphosis, other postural deviations as well, spinal stenosis, herniated bulging discs, the list goes on. So folks, I do need you to take a peek at the video first, to really watch it and make sure it's for you before you engage in the exercise. And I'm going to give you some modifications as well. So standing with the feet hips width apart, I'm placing the hands lightly on the thighs. And on the inhale, I begin a spinal extension. It's like a little bit of a back bend. Elbows are straight, knees are bent. We broaden the chest, we lift the chin. Now on the exhale, I keep the chin up. I'm going to tuck the buttocks under first, round the spine, belly button in, and then I lastly lower the head. No stress in the shoulders. On the inhale, I come into the spinal extension, I like to call it a little baby back bend. And then on the exhale, we're coming into the spinal flexion. It's like a standing abdominal crunch. Now, for those of you with those spine issues, I don't want you in spinal flexion. So I'm going to show you how you would do this. You inhale into spinal extension, but then on the exhale, you come to neutral. The rest of us are going spinal extension into spinal flexion. And Cyd, we are in South Beach, so we're hearing some noise on the outside. I hope it's not over drowning me or anything. And one more time, spinal flexion, holding here. And again, just like a standing abdominal crunch, pull that belly button so far in, you almost feel it coming out your low back. We're targeting the transverse abdominis, the deepest of the core muscles. And we slowly roll up to stand. You always want to inhale the head up, because this will offset any kind of orthostatic hypotension or rapid plunge of the blood pressure. And let's say you take a couple of shoulder rolls. So we've done spinal extension and flexion. Standing with the legs together, let's incorporate now lateral flexion, side bending. So whenever you get the legs together, it will challenge your balance. This is a good thing, folks. That's okay. So I'm going to slide my left hand down, bending my left knee. Now turn the sternum toward the ceiling. From here, depending upon the shoulder, if you have a right shoulder issue, just keep your hand to your waist. Otherwise, You bring the arm up and over. You go to your comfort zone. So maybe this is your comfort zone. But what I don't want you to do is this. A lot of times people bend the elbow and thinking that's going to help them go over more. It's not. It's going to hurt your shoulder. So you keep a straight elbow. And you just keep going to what your range of motion is. Hips forward, torso back. You're not twisting. You're just rotating toward the ceiling. Breath in and out through the nose for the moment. And I'm stretching the intercostal muscles between the ribs, the obliques at the waist. Now I'm going to turn my palm up, grab an imaginary hook. You're not going to see it in the camera, but you know that's what I'm doing. And on the exhale, I reach out, push down into the right foot to return to center. We go directly into the opposite side, sliding right hand down, hip forward, torso back, sternum ceiling, hand waist, or exhale, arm up and over, following through for your lateral flexion, side bending. So those intercostal muscles between the ribs are responsible for 25% of your respiratory cycle. Inhale, turn the palm up, grab a hook. Exhale, push down into the left heel, reach out through the left arm, come back to center. We're going to take a couple of shoulder rolls, and then we're going to do our airplane motion, which is rotation of the vertebral column. So I stand with the feet wide apart. Now, maybe that's too wide for some of you. That's okay. You can make it more narrow, no problem. But what I want you to be aware of is your circumstance, so that when you start to move, you don't knock anything down. So you keep it nice and simple. It can be closer together if you need, but notice here, I'm going to stop. The back heel is lifted. We have ankle, knee, hip, following the same line as my head. Same thing, I go to the other side, just so that you can see it on both sides, no matter how big or small the movement. I can go faster if you like, and I'm going to start to slow it down. And now we're going to move into the actual strength training component. Accessories are light dumbbells, as I had mentioned, also a Dynaband, which is known as a TheraBand, and believe it or not, if you don't have the light weights, a large umbrella will do. And I kid you not, folks, I did some of this stuff when I had that cast on, that is for sure. So I'm going to start off with just showing you first how to do a squat, a basic squat, and then I'm going to tie in the use of that umbrella, you'll see. So we line up, hips width apart again, and I'm going to step a little bit forward, bringing the arms out. I sit back into a chair with the toes lifted. I push up from the heels, and then I do a little squeeze of the gluteals at the top. I'm going to show you from the side. So I sit back into a chair. Don't worry if you can't go that low, that's okay, but notice that little slight pelvic tuck and squeeze of the buttocks. That's a little subtle back extension. So now I'm going to level up by holding on to the umbrella, bringing it out front, shoulder height. I'm going to help strengthen the deltoid muscles simultaneously. We're going to do supersetting. That is 2 different exercises back to back without rest. Make sure you keep yourselves hydrated. I'm sitting back with the toes lifted. Now, why do I lift the toes? So that I can drive the exercise up from the heels through the buttocks. That's why we do that. We engage the gluteals more this way. We also strengthen the shins, which is excellent for your knees and your balance. One more. Inhaling and exhaling. There we go. Now I'm going to be stepping closer to the camera to show you the next exercise. And we're going to be doing what I call a bent over bilateral row. This is for the upper back. Now, why is this important for us? Well, for those postural deviations, right? The same way squatting is excellent. You get up and down out of a chair, in and out of your car, and frankly, folks, you get up and down out of a commode. So this is activities of daily living. For those of you with those spine issues, I don't want you to bend over. You're going to stand up tall and you're going to focus on this movement. So what I'm doing is working on scapular retraction. So Cyd, could you see my upper back by the shoulder blades, the scapulae? Can you see that area moving?
Yes. Yeah.
Okay, so that's what I want to emphasize to people is keep yourself up this way. Otherwise, to level up, here we go, folks. We bend the knees, it's bent over, arms out, exhale, pull. So 8 to 15 repetitions. We do the round twice. Couple of more repetitions here, drawing those shoulder blades toward each other. One more. Standing on up, I'll adjust my camera and let's get back to our umbrella squats. Okay, here we go. I'm going to stand to the side, step out a little bit so I don't knock into the backdrop. Here we go. See that with the pelvic tuck? Don't want to make it too big. I don't want a big back extension. So the extensor muscles we're working on are the quadriceps, the front of the thighs, the gluteals, which are the buttocks, and your back muscles. So you inhale, exhale on the effort. The effort here is the rising up. Hold here, and now back to your row. So remember, those of you with the spine issues, you're doing it erect, upright. Otherwise, you want to level up, folks. Just the use of the umbrella will help you level up. Notice the chin is lifted. The reason is I want the cervical spine of the neck to duplicate the movement of the lumbar spine of the low back. They're both a natural lordotic curve, which in essence creates extension. One more. Slowly come up. Now let's take it back to the mat for the next round. So now we're going to do narrow squats. And that means feet right up against each other. Challenge your balance, you bet it will, okay? Now I'm going to change the position of the umbrella though, because I want to level up. Arms up. Now, if you have rotator cuff issues, if you are medicated for hypertension and you've been told not to hold anything overhead, or if you have a pinched nerve in the neck, go back to this position, all right? Otherwise, I'm going to turn to the side again. Feet are together, overhead. Sit back into the chair, toes are lifted. So doctors Cyd talk about doing multiple movements at one time when you're strengthening your legs, and well, lo and behold, this helps cognitive impairment. How about that, Cyd?
We all need that.
That's right. 2 more. So why not put it in there? And lower down. The next exercise, so we work the back. Now we want to target the chest. What do we do in life using the chest muscles? Chest muscles also typically will incorporate in their movements, their actions would be the front deltoid and the tricep muscle. So when you push a heavy grocery cart, when you push a heavy door open, when you push your beautiful grandchildren, right, in their stroller, this is primarily here. That's why we want you strong. So take that umbrella, bring it out in front. It's almost going to look like the other one that we did for the upper back, but the emphasis here now is going forward. So we want to make sure, if you look up here on me, that that's not collapsing. A lot of times people will do this. No, want to keep that upright. Now, if you want to level up and you don't have any spine issues, then you can lean back and almost take it like an incline chest press. Belly button is in, my knees are soft. Exhale. And I'm going to do one more and relax it. We're going to go back for those narrow squats. I'm going to show you from the front this time, okay? There we go. So feet together, arms up, sit back into a chair and take it up. So if you don't have like a valgus knee, not knee, then you can press your knees into each other, particularly for women, because we are broader at the pelvis. Men usually have no challenge with this type of squat, but women do. There's that little subtle pelvic tilt at the top, which is a posterior pelvic tilt. One more. So this is what's meant, folks, by supersetting, alternating. Not giving yourselves much rest, try to get in as much as possible. Chest press. Keep the chest puffed up, proud as a peacock, particularly right here. This is where people give into the abdominal, pulling you down. Don't let that happen. You can also do this lying down on the floor on your back. If you can't get down to the floor, you can lie down on your bed. I'll show you a couple more on that incline, leaning back. One more. And take it in. Here we go, next round, a couple more new exercises coming up. All right, so squats are compound movements. So is this next one. It's called a deadlift. Basically, I want you to be able to bend down, pick up something off the floor, and not even have to think about it to get up. But sometimes we do have to think about it, right? So this will help you prepare you for that activity of daily living. So I'm going to demonstrate again the squat. And then I want to demonstrate the deadlift before we actually do the round. So here's the squat. Same setup, feet hips width, toes lifted, arms out. So it's the sitting back into a chair. Now for some of you, it might be this. That's still doing it, folks. That's fine by me. But now, here's the difference with a deadlift. I'm going to bend the knees. And what I do is I'm hinging forward from the hip. The acetobulofemoral joint, also known as the coxal joint. The knees are bent, the head is up. And then as I exhale, I come up, and then there's that pelvic tuck, squeezing of the glute. You see the difference? One is sitting back, the other one is a hip hinge. Don't do this if you have those spine issues. Go back to one of the squats, all right? So you can use your umbrella. I'm going to tie in some hand weights for this. So I've got 10 pounders. I'm going to face you. Now, typically when I full out have my strength, I can do this with 20, but not yet, folks. Not until I get more physical therapy. So notice how my form changes once I actually have weight in the hands. Everything is just slower, and it should be. You want to pay attention to the form. Now, maybe you don't have those spine issues, but maybe you don't have the range of motion. So I don't mind this. I want to see a bent knee, and I want to see a pelvic tuck. Why not? It's all doable, folks. One more. Place the weights down. Be sure on your surface they don't roll around. See that? I could have fallen off, so I just wanted to show you what could happen with that. Now, next exercise, I'm taking out my Dynaband. It's also known as a TheraBand. I'm holding up the band to a light, scanning it to make sure that there is no pinhole, because folks, you use that anywhere near your face and it can snap and hit you in the face. Been there, did that, not fun, all right? Now I'm going to show you the exercise first without the band. I'm going after the posterior deltoid, the back of the shoulder, but also continuing with that upper back region. So we're talking about the middle fibers and upper fibers of the trapezius. We have the rhomboids, got a whole bunch of stuff going on back there. And so I want you strong in your deltoids so you can get heavy stuff out of a cupboard overhead. And these exercises will help you. But this one too will be excellent for those with postural deviations. So without anything in my hands, you hold your arms out like so. And basically, I'm going to turn with my back here for you again. Cyd, am I fully in the screen?
Yes, you are.
Okay, thank you. So we're going to draw the arms back slowly, and there's your scapular retraction. And then I bring them back out in front. Now, I'm going to show you something from the side. Typically, people do this, and they think they're going to go further back if they jut their head forward. No, they're not. They're going to put a lot of 12 pounds of strain on that cervical spine for every inch of forward head projection. So please don't do that, all right? So you can absolutely do the exercise this way. I'm going to show you now with resistance. You want to hold your band. The closer together the hands are, the more resistance you're going to work with. For some people, they might need to double up if they're super strong. So pelvic tuck, stand tall. Now notice I'm lifting up toward the band, chest up toward the band. Otherwise, you're going to see people collapse. Also, I'm not bending the wrist. Scapular retraction. Excellent to help you in life, activities, daily living, postural deviations. I'm going to go for one more and release. Good. Heading back over to the mat for those deadlifts. Second round. So you see how this works, folks. Compound movement, multiple joints and muscles, also engaging the larger muscle groups. Chin up, cervical and lumbar spines duplicating each other. Take your time. No pain. Forget that expression, no pain, no gain. Forget that thing, that's garbage. One more. Hold here. All right, grab that band again, second round. And we have one more round after here, folks. Now there's a little trick you can do as well with wrapping the band around your wrists if you can't hold it in your hands. Any which way you can handle it, it's great. So you see how that chest goes up toward the band. I'm going to go for two more. Because I'm feeling this, and it's about my fourth time today doing this. And relax it down. So I'm going to be staying up top here, demonstrating without the weight first. So the next two muscle groups we'll be doing are triceps and the bicep. So what are the activities of daily living? Well, I always like to show this because it covers both tricep and bicep, is the act of vacuum cleaning. So every time I go forward, it's an extension. Tricep, front delt, chest. That's that trio that tends to work together, right? So it's out here. When I pull the vacuum cleaner back, then I'm going to get bicep, back, posterior deltoid. Also for triceps, when you swim, a lot of tricep involvement. When you close the hood of your car, tricep, and then it's involved with the pushing of the heavy cart, what have you. For biceps, well, every time I bend down and pick up my delicious tea, terrific cat that he is, anytime that you bend and flex those elbows, you're going to incorporate your bicep muscles. If you want to bend down, pick up your grandchildren, right? Bicep muscles. Also, when you go grocery shopping, you don't want to hang the hands, hanging down like this. It's terrible. Even when you unload the groceries from your trunk, So what you want to do is get those handles over here, curl it in, and then get tight into the body and walk into the house with your groceries standing tall. So the first exercise is called a tricep kick back. It's going to be done bent over with the weights for leveling up, but I just want to show those of you without any exercise accessories, or those of you with those spine issues, all right? So you're standing tall, elbows are bent behind you, and you extend the arms. But notice the elbows are not moving around. A lot of times people do this and then they drop. And it's like, no, keep the arm up. So the elbow's a hinge, and it's acting as a hinge right now. You also get posterior deltoid here. So that's how I would like you to do it. And if you want to do the bent over version, if it's appropriate for you, go ahead without the weights. That's fine as well. You can use your umbrella behind you. I'm going to grab 5-pound weights, bending over, and keep that chin up. A lot of people love to drop the head down. Try not to let that happen. Now I'm going to add up. I'm going to level up, I should say. I'm going to add in what's called supination. See that? That means palms up, face up. It gets into the tricep a little bit more. And relax it coming down. For the biceps, I have a new one I want to teach folks. This is what I call a reverse bicep curl. The weight is in front of the thigh. So an osteoporotic site would be forearms and wrists, right? Well, if you do your curls like this, you get all of it at one time. Elbow points down for bicep. It points down. I'm hugging the upper arms, inner arms, with the outer upper ribs. One more. Back to the bent over tricep kick back, or upright if that's your adjustment. Here we go. I'm feeling it. Chin is up. Cervical spine and lumbar spine duplicating each other. Woo-hoo. It's talking. Try a couple of supination. One more. And easy coming up into reverse bicep curls. Belly button is in. Play some music, folks, when you lift weights. It's so inspiring. It's so much fun that way. Discover the potential that lies within you. Just don't assume, no, I can't. So when you look at the video, look for what you can do. You already know what you can't do. One more. And down. Ooh la la. So now, Cyd, I'm going to end the actual exercise sequence with a cool down. The cool down will be the same as the warm up for the spine. All right. So I'm going to face you for these now. Hips width, soften up. Inhale, spinal extension. Exhale, spinal flexion. Notice the head drops down last. Inhale, open up across the chest, lift the chin. Now, this moment, when I lower the head down, blood rush to the thyroid gland. Excellent for both hypo and hyperthyroid. Inhale, one more. Exhale, let's hold. Pretend you're standing and doing an abdominal crunch. Draw that belly button in. Relax the shoulders and neck. And then I slowly roll up, inhaling for the head to come up last. Couple of big shoulder rolls. Now I'm going to show you a little bit of a different way to do the lateral flexion, the side bend. You take your hands and create a steeple. See that? Index fingers and thumbs pointing straight up, because you won't see this with me in the camera. My arms are up and overhead. Now, for those of you who were told not to lift the arms up and overhead, don't. You can do this without the arms up in the air. You can just keep your hands at your sides. Then inhale, I'm going to reach up, and exhale. Take it over to the left. Breath in and out through the nose for the stretching. Now inhale, I am reaching up to come back to center. Exhale over to the other side. Such a delicious stretch. Hips forward, torso back, sternum toward the ceiling. You want to hold your stretches for 20 to 30 seconds. Inhale, push into the left heel, reach up, up, up. Exhale, hands come down to the heart in gratitude for the good health. And then we're going to do those airplanes one more time here. Wide or narrow, it doesn't matter. Just safety in your circumstance here. And then take your time. You can go fast or slow here, but just don't make the technique, the form sloppy when you go fast. You really want to pay attention to the form. Heel is lifting, and then we start to slow it down. And that's what I have for your viewers today, Cyd. Thank you so much. I had so much fun with you. I really appreciate this.
Oh, that was incredible. And you've done this earlier today too, right, to practice? So
Oh,
yeah. I love all of
Absolutely.
this. I love the tips to reduce inflammation while you're exercising, right? Because you're using the proper form. You're really explaining it in such a clear manner. And these are pretty simple moves, right? There's
Right.
for people
right.
that think they cannot do this, they absolutely can. I love what you said. Like, don't assume you can't do this. Look for what
That's
you
right.
can do.
That's right, because we do, listen, you know what you can't do. I know what I can't do, right? But the thing is that if we approach exercise from that perspective only, well, you know, you're never going to get up.
Right. It's 80% mentality, right? It's
Get up.
those things.
So it's, you know, I want to make an offer to your viewers because I want to encourage them to do something. So for those who might be a little frightened of doing this type of work, if you contact me by way of my contact form on my website, which is boomerandbeyondwellness.com. I'll just say it again, boomerandbeyondwellness.com. You tell me, hey, I saw you on Cyd's show, and I will ask you to send me your email, and I will send you a 35-minute chair yoga-based stretch class that you can do in your office. It's for anybody in any office chair, except with wheels. You don't want wheels. You can do a wonderful stretch routine and get yourself open to experience what it's like to start to exercise, to start to move your body, particularly for those of you who are really frightened. You don't have to be. Just we've got to break it down in easy steps for you.
Okay, I'm going to share the screen with your website on it. But
Thank
if
you.
people do want to work with you, what's the process if they do want to consider working with you? What would they do?
Well, I really appreciate that because I do, my work for personal training is typically for those who are 55 and up. And that's done virtually. I also do virtually hatha and prenatal yoga instruction. Now, if people are kind of limited and they need chair exercise or chair yoga, we can do that as well. On site in Miami Beach, I do massage therapy, and my kind of my specialties would be Swedish massage. And for some people, they like me to go super strong, so you would call that deep tissue. But a lot of my work is actually the opposite end of the spectrum, which would be geriatric massage. So what I do is I work with people. Those are 30-minute sessions. They're not on the table. They're typically done either in a recliner or a home hospital bed for people with some advanced stages of Alzheimer's or Parkinson's. And I also am brought in for palliative care massage, which would be really trying to help someone's loved one to transition to the other side to make that process comfortable. So what you can do is contact me via the contact form on my website of boomerandbeyondwellness.com.
Okay. And there
it is.
There's your picture and your website.
Thank you.
And yeah, if anybody, do you work with people virtually too, right? And
yes, that is almost all of my work is virtual. I you know, maybe if people would like to experience this, Cyd, I'm a video provider for the platform that Chef AJ has hosted for quite some time called Feel Fabulous Over 40. And what they do there is they offer special, like if you sign on for a trial for $1, then what'll happen is you're open to all of what the platform has to offer. And that would include my exercise and my strength training and yoga videos that I provide exclusively to that platform. And once a month, the third Thursday every month, I do teach a live Zoom class for that group. So that would be a part of that $1 trial period. People can ask me about that as well if they would like it to make it a way that they can work with me.
Okay, that's incredible. I love how, I mean, this isn't because we want to run marathons. This is for everyday functioning.
That's right.
Of life, picking up your children, pushing grocery carts. Right.
Right.
What other examples were you giving? Reaching up to get things out of the cabinet. These
Vacuum cleaning, closing your trunk of your car. You know, this is all stuff that getting off of the commode is an issue for a lot of people unless they have something that's elevated, which isn't really great for your functions, right? To void out, it's not a good position to be in. So the commode is typically lower than any chair, and some people can't get up. So I am really looking at stuff that is really stuff we do every day that gets more and more limited. And it doesn't have to be if you just strength train those muscles involved, but also moving those joints, right? So there's mobility involved in this process as well.
Right. So I encourage everyone today that's watching this video to contact Angela, especially if you're a boomer, right? Over 55, but anybody, I'm assuming.
Sure. Yeah, but sometimes people who are younger actually are encountering some of these conditions more and more often.
Yeah. Okay. Well, everybody, it's boomerandbeyondwellness.com.
Yes.
And again, if you have any questions for Angela, contact her there. Or if you have any questions about her exercise routine, or any questions at all, right, Angela?
Absolutely.
Just put,
and don't forget, if you want to have a 35-minute session sent to you on yoga, but it's like I said, in a chair and primarily to help you in your office. And I think most of us who are just sitting at our desks on the computer, right? You know, that's kind of like your home office, right? So this could be something you can do for yourselves.
Awesome. Thank you so much.
Thank you so much. I always have so much fun with you, Cyd. I have such a great time with you, and I love that you're also Italian. It just cracks me up. Cracks me up.
Okay, my paisan.
There we go.
I'm going to end the recording here.
Okay.
But stick around, and thank you everyone for watching tonight. I hope you found this helpful. This is everyday stuff. This is so your body can function, right? As you get older, you want to be able to function, and Angela can show you how to do that easily and clearly understood. So let me stop the recording and wish you all a good night